Hello everyone, here is Brigida Chembida. Today we are talking about the N-of-1 trial in the the N-of-1 trial are that one we can choose some subject, and after that we can cross this subject, the same subject, um, just to try to test the same drug, different drugs, sorry, in the same subjects. And for the control, these patients are their own control, and sometimes this placebo group is eliminated. This placebo group is like zero. Well, there are some advantage like the low number of subjects we can use in rare disease because of this. Because of this also we can use this in personalized medicine, and that is ethically good when we consider that the patient is his own control. Okay, but there are also some disadvantages, like the external validity that we cannot predict. The statistical analysis sometimes is so difficult to perform, and the higher bias, the higher level of bias that we can have, the error type 1, the washout period also, and the carryover effect. So here I'm sharing with you the last statement of this N-of-1 trial. The last one, it was realized in 2015 by the SAN consort statement. Okay, and after that I'll show you an article that I found regards neurosurgery and the N-of-1 trial. Okay, so here is the trial. The name of the trial is the N-of-1 trial for assessing the efficacy of deep brain stimulation in neuropathic pain. So here I will do for you a critical of this trial using this statements of this last consort. Okay, so here in the title there are identified the N-of-1 trial in the title. So here we are okay. So here we talk about the abstract. So we here and the structure summary of this design, the method, the result, and the conclusion. So here the abstract, they said something about the objective, okay, and they talk about the number of the patients, the methods they use it here was like the N-of-1 trial, okay, and the results and the conclusion, okay. But here for the results they really don't say us about the number, what are the number of the results, what are the results here. But here, if before I give them like a green consideration, but here they really don't say about the number of the what was the result here. Okay, so about the introduction, here we have to consider what was the scientific background and explanation of rationale. So the scientific background here, if we can remember, the journal here is a specific journal for neurostimulation, so they really don't doesn't explain us some things for people that are not subspecialists of this pain management. Okay, so here they talk about the DBS device that is used to treat patients with severe pain sometimes. Okay, but that it is used for other kind of stimulations in people. Okay, and they explain something that this device was used to treat neuropathic pain, um, but they really don't explain for us which kind of patient is this one. I think that is because of the subspeciality. Okay, so here the journal the journal here is important consideration. Okay, um, here when we consider where this article is inserted, so here they just say that, oh, here we use a stimulator, and for me it's okay. So, and why the rationale of using this N-of-1 approach, here they say that the number of patients are small and the type of neuropathic pain treatment are diverse. And here they say that this for reason and because of the subjective nature of pain, it is difficult to carry out informative trials looking the different treatment between patients. So here they said about the number of people, and they did a randomized double-blinded placebo control using uh, within patients is they thought that using the patient with like his own control is like better than using other patients for the same purpose. Okay, because of course here the people are so different in like his pain and sharing his feeling of pain. Okay, so here I also give my big thumbs up for the needed and the rational use for N-of-1 approach and the objectives and or hypotheses of this trial. So here they describe it, how long the N-of-1 trial are used, like by 10 years ago. So this trial is of 2004, and okay, but they sorry, they really here don't speak us about the objectives or specific objective or hypothesis. So here I think that is because of this that I said for you. That is a specific journal of pain neuromodulation. And because of this, they really doesn't say for us like the objective here is like see if the patient reduce the pain using this device turn on or off, and the hypotheses here are not clearly set yet. Okay, after reading all the entire article, I found the objective or hypothesis. Because of this, I give my thumbs up here, but we cannot find all the explanation that we need in the entire article. Uh, here about the also the specific objective and hypothesis, as I said, they try to explain, but not in the entire process. Okay. So here for the methods, as they previously said, the trial design was a double blind, okay? But here in the methods, they really, sorry for my letter, but here and as they said before, is a double blinded trial, but they really don't explain how the trial is. Okay, so it's parallel, it's factorial, the allocation radio. Okay, so here let's that check. There are 7 patients underwent placement of deep brain stimulation for neuropathic pain. The etiology of pain range for thalamic infarct to posturing decompression. The age ranged for 24 to 55 years. 2 were female and 5 were male. The target for DBS includes the periventricular gray matter in 4 patients and the ventropostal nucleus of the thalamus, the VPL, in 2 patients, and the combination of both in 1 patient. So, preoperatively and postoperatively, and at 6 months, they performed 2 questionnaires, the McGill Pain questionnaires and the VAS scale, and recorded at least in 10 occasions and with at least 1 day between and before internalization of the electrode. Okay, and this was random testing, but we aim to complete the 10 results within 2 weeks to avoid infection and risk of external electrodes. Okay, here they said that was the patient were random, okay, but they really don't explain us, like they said before, how was these methods, okay. So it was a randomized clinical trial, but here they don't say it for us, unfortunately. But I give here my thumbs up because they explained it before. There is not in the methods, but they try to explain here, okay? But not the entire. So here I consider that they must pay attention where they put the, okay. For also for the trial design, for the description, the design, the planned number of periods, they said here before that we try to do this analysis at period pre and post operatively in 6 months, um, including the running and washout period. And here, as is a device, it is difficult to understand how long is this washout period because it's not really a drug, okay. So here I consider that it's okay, we are okay here. And also for the trial, the important changes in methods after trial start. Here they really don't do anything, really don't perform any changes during the trial. So here also we are okay. But they really don't explain if they don't explain for us if they change these. They really don't explain here if they did this change during the trial. Maybe here is a problem, don't know if really it's a problem here for us, okay. And here for also for the methods about the participants, they give us this table one about each one of the participants, the 1, 2, 3, 4, 6, and 7 patients, okay. 1, 2, 3, 4, 6, 7 patients, okay. And they try to talk about how was the diagnosis, the type of pain, the age and sex of all these patients, the target point of the device were inserted, okay? But for the comorbidity conditions and the concurrent therapy, they really don't explain for us uh, what which was the like the principal characteristic of these patients, okay? So here I think we have some problems, okay? But um, about the comorbidity conditions, principally the comorbid conditions, they just talk about the sex of the patient, but they are not like to consider other things, uh, other factors that are included here and can also affect the results. So here I think we have to pay attention in this after at the end of this trial, okay? So also for the methods here about the intervention, they explain us how the intervention is. So here we must consider the intervention for each group with sufficient details to allow replication, including how and when they actually administer this intervention. So here they said about the study was approved, the were approved by ethical committees, the informed consent was obtained for each participant, and here they said that they put a stereotactic CT scan was performed and then using an image vision to coordinate the anterior and posterior commissure. So here they are trying to explain how the surgery was performed. Okay, so here we are good for this because they are trying to explain how the surgery was performed. Okay, and also they explain all the points here in which they insert the anatomical position. Uh, so they how they performed the deformation. The scalp incision was in the frontal scalp, 3 centimeters from the midline. So it was like usual surgery for this device, okay? But here they are trying to explain us how they did this. So here we give our big thumbs up, okay? And here for the intervention, they just show us some pictures where the device is inserted is here. Okay. And here is just another picture that I show for you just you to know where the how looks like the device. The an electrode is inserted in the brain and like is spreading some electrical signs and stimulating a point in which this point like are trying to reduce pain in the patients, okay? So here uh, are some part of the details. So this picture is not for the article, but here I thought that it was important just to you to know uh, how the procedure is, okay? So here for the intervention, I thought they explain everything. They tried to explain everything. Also about the intervention, um, they we must here to consider uh, each period, if the period was sufficient, uh, show us sufficient details to allow replication. And here they try to explain that the electrodes were sterilized during 1 to 2 weeks in all patients, and they give us other specific things like the the generator were implanted with general anesthesia, and pain was assessed before and after surgery within 2 weeks and 6 months, and during stimulation uh, with VAS. Okay, so here I consider that for me it's okay for understanding the process, but here they really don't explain uh, which was the the characteristic of this patient in this part of the methods. Okay, and we will see that we will explain this after. And also for the outcomes here, I think that for the outcomes here is the main problem, because as I said before, as is a pain journal for neuromodulation, they suppose that the guy that is reading these articles are understanding that the main outcome here is like trying to reduce pain, is trying to manage pain with the device. But here they really don't explain it for us what is the main outcome of them. Okay, so is defined the primary outcome, but is not uh, so specified. There is not a description and measurement of the validity and reliability of the outcome. So here, before this class, I thought that first, we have to consider that this article is inserted, as I said, in this uh, pain journal. But okay, so if you are a specialist, okay, you can understand what is this. But if you are not, you cannot understand what are the primary and the secondary outcome. So because of this, I think that you have to pay attention in the description and the validity and reliability of this trial, because they really don't explain us how they did the how was the primary and the secondary outcome here. Okay, so for the methods, as I said, they really don't define the primary secondary outcome, how and then where they were assessed. Here they try to explain how was the management, like how the patient managed their device. So the patient, uh, when they like trying to consider if they have pain or not have pain, the patient like turn turn on the device only when the patient have pain. Okay, so here the patient maintain turn off the device, and when the patient feel pain, they turn on the device. Okay, and here also here the patient three maintain the device on and the device off. Okay, so okay, here I think they try to explain things, so for me here it's okay. So for also here they try to explain, uh, completely explain things, but here we have a problem, because okay, here is a table that a figure that try to explain us how uh, the patient like are distributed, like the pre and post subscale. But here unfortunately this is for the results, it's not for the method. So here they really don't completely define and specify primary secondary outcome. They really don't plot also the flow chart here trying to explain the how these patients were like distributed. Okay, and any changes of the trial and the outcomes after the trial commenced with reason. Here there were no change during the trial. How was the sample size was determined here? They really don't explain how the sample size was determined. I think that of course that was determined by choices for like specialists of pain specialists, but here they really don't explain us. And the interim analysis here, they talk about like the VAS was recorded at least in 10 occasions, at least one day, and aimed to complete the 10 tests within 2 weeks. Okay, so here they really don't say that it was an interim analysis, um, but I suppose that it is, but they really don't explain that it was an interim analysis. So okay, here I think that we have a problem of understanding this part of this trial. For the randomizations, the method uses to generate randomization and the allocation sequencing. Here, they say